Hello, lovely. This video is for you if you have cancer and are concerned about the potential for weight loss, or are already starting to experience weight loss, or even if you have more advanced weight loss, there can be some helpful things in this video for you to prevent further wasting away and perhaps even pack on some more weight. And yes, even if you are overweight and think this is at least one positive of the cancer, it's really not. You still want to be careful with this weight loss, even if you are overweight, because we're not just losing fat, we're losing muscle. And overall, the process itself is not a good thing because it's feeding the cancer. So we do want to take preventive measures for sure. Hi, I'm Dr. Lisa Matejka, naturopathic physician, energy worker, and transformational life coach, and I help those with cancer navigate their journey back to an even better state of health and wellness than before, physically, mentally, emotionally, energetically, and perhaps even spiritually, with my compassionate guidance and loving support. And yes, as well as all my knowledge and experience, which I'm going to share some of that with you today. I'm going to share some really useful logistical tips and tricks, some dietary stuff, and even some supplements. So do stick around. And I do want to give a disclaimer up front. So, first of all, yes, weight loss can happen, whether it's due to the cancer itself. It can also be accelerated by conventional treatments. It's typically going to be because of the cancer itself, but yes, conventional treatments can accelerate it. And cachexia is a serious condition. Now, this is when you have lost 5% of your lean body mass in 3 months or 10% of your lean body mass in 6 months. So yes, somebody should be keeping track of this, you or your doctor, your weight and whatnot. And this video is going to be helpful, but you really want to be working one-on-one with somebody, especially if you have a more advanced case. You really want to be working one-on-one with somebody, a naturopathic physician, a oncology specialized dietitian or nutritionist, because you're going to need somebody who knows your exact situation. So kind of take what I say as like a guideline and things to take to your professional of choice. Okay? Okay. So I would say one of the first things we need to do is figure out, where you are in this journey, how aggressive of approach is needed, and how many, based on your weight and everything, your age, your cancer, your situation, how many calories, how much protein, how many carbs do you need to be consuming daily? It's good to have a number for this so that you can actually try to achieve it. And a general guideline from oncology focused registered dietitians is this: 1.4 to 1.5 grams of protein per kilogram of body weight daily, and 30 to 35 calories per kilogram of body weight daily. So, of course, if you're in the US, you have to take pounds, convert it to kilograms, and then you have to do the math on that. Okay? And there's also something called the Harris-Benedict equation. And this is something that can be useful for predicting how many calories you need each day based on age, weight, height, other factors. But I'm not going to really get into the Harris-Benedict equation. You can look it up if you would like. But there's still it's still not a consensus of whether this is the best thing to be used or not. But certainly these things I mentioned are helpful than just winging it. And so how can we ensure we are getting enough food in? So number one, there's going to be a problem with loss of appetite. So I'm not going to really get in this video into things that can help you with loss of appetite because I did a video on that already. So I'll leave the link in a description box, but do check out my video. And that video is entitled simply How to Fix Loss of Appetite. And the thumbnail says something like, Are you hungry for nothing? So you can check that out because, yes, if we can increase our appetite, that's going to just make it easier for us to get in the proper calories, protein, and carbs. By the way, the recommendation I just gave, that's by registered dietitians, about the 1.4 to 1.5 grams of protein per kilogram of body weight daily and 30 to 35 grams of calories per kilogram of body weight daily. That, I forgot to mention, is specifically for stage 4 cachectic patients. So that's what's needed in the more advanced stages. Okay, so before we get into the meat of things here, I do want to say this can also be really hard on your psyche, psychologically, emotionally, mentally. To see your body go through these changes can be very difficult. So there are some evidence-based things that can help with the psychosocial component, and those are things like yoga, meditation, and support groups. So I just wanted to mention that first. And then I just briefly want to talk about exercise. So obviously, firstly, you're probably not going to feel like doing intense exercise if you're losing a lot of weight. It is still a lot of times a good idea to do some form of exercise in cancer, but that's not what this video is about. Obviously, you don't want to do aerobic exercises, these sorts of things you don't want to do now, but not all forms of exercise are completely out of the question. Things that build strength and build muscle, like strength training yoga or, some like lighter weightlifting, those can still be appropriate. But again, you want to work one-on-one with somebody. There are like oncology specialized personal trainers, physical therapists. Don't just take my word for it, work specifically with somebody, but just so you know, those can be, of course, better exercises than aerobic to do. Okay, so now for some overall strategies, tips, and tricks logistically. Okay, so first of all, a lot of energy, you're going to be feeling fatigued, not having a lot of energy. So it's really nice if you can have a nice support system. And sometimes this means asking. Some people aren't comfortable asking for help, but sometimes that is what you need to do. And you'll be surprised at how many people are happy to help you. So if you can garner the support of loved ones to help you with the food shopping, to help you with the food preparation, that is going to be very helpful because a lot of times, if especially people are on their own and not asking for help, they're just not going to eat because it's too much effort and too much work and takes too much energy, and then you're going to waste away even faster. So seek help. And if you live somewhere or have a situation where you don't have family and friends to rely on, then there are professionals that can be hired, caregivers and whatnot, and it is definitely recommended. Again, this is your life we're talking about. So seek the help of people that can help you with these things to set yourself up to win. What I'm talking about now is all about setting yourself up to win. So the next thing is, it's really, it might sound kind of strange, but it can be a really helpful thing to have like a cooler packed, and you can have your caregivers support system do this as well, but kind of have a cooler handy with some easy to grab, readily accessible, nutritious snacks so that there's something always available. So like the idea with the cooler is you can take it with you on the go. If you have appointments or you still have to, whatever obligations you might have, you can take this with you on the go. Or if you're really not, if you're really kind of bedridden, then you don't have to worry about getting up and going to the refrigerator. So having a cooler handy with you wherever you are that already is packed full of good nutritious snacks makes it a lot easier to just grab and go and eat. And going along with that, it's a lot more helpful for if you're in this situation to eat more small, frequent meals throughout the day rather than, 3 meals or a couple meals. And it's also not recommended to just eat when you're hungry. That might be a good rule of thumb just for, healthy people, to just eat when you're hungry. But in your situation, no. In your situation, yes, do eat when you're hungry. Take advantage of that hunger to the best of your ability to eat as much as you can, but also eat when you're going to have to eat when you're not hungry. So it can also be helpful for people to schedule eating times throughout the day. This way they have that availability already, like, oh, got to eat at this time, got to eat at this time. And you can schedule these 5 to 6 times of day to eat. And also it gets your body used to eating at these times. So you can grow to sort of even just your body getting used to eating during these times and maybe even getting hungry a little bit. But the idea is you're going to have to force yourself to eat a little bit. So you're going to have to eat even if you're not hungry. So it can be helpful for people to schedule this in. So that's something that they're like programming themselves to do. And smaller, more frequent meals can be more palatable, more easily digestible, more tolerable, more pleasant, than eating these bigger meals. So that is a recommendation. And then don't be drinking liquids with the meals because that can fill you up. You can fill up with liquids and then you won't eat as much. So it's recommended to get your fluids outside of the time frame of eating. This, of course, is different if you're on a liquid diet, which I'll get into that a little bit later as far as like nutritional drinks and whatnot. And then some more tips in this arena is general things like, this is also probably fairly obvious, but just in case, don't be going for, low fat foods, low calorie foods. This is a time where you want to pack on as many calories and protein and carbs as possible. Now, this doesn't mean consuming a bunch of junk food because it's high calorie, because we, of course, especially now, that's exactly the opposite of what we want. We want to really optimize getting our calories in, high calorie, but also nutrient dense, protein rich. Well, back to the drink thing. Rather than drinking, and this goes throughout the day, rather than drinking things that are empty calories, it's better to be drinking nutritious smoothies and or meal replacement drinks. So for example, and depending on how bad your situation is, I'm usually a huge advocate of water drinking. If you are if you're cachectic at this point and really kind of wasting away, you can get your water intake through other things like smoothies and soups. So rather than consuming empty calorie drinks, and certainly better than like, store-bought juices, sodas, teas, lemonade, don't do none of that stuff. You want to optimize your fluid intake by also getting nutrients. So do nutritious smoothies and meal replacement drinks. And you want to do, even if you're trying to get in your calories, protein, and carbs from food, still do these meal replacement drinks because you're going to need all the help you can get. And not Ensure. That is what's recommended. That is what's recommended by mainstream oncologists and even some integrative cancer centers, which is crazy to me. No Ensure. The Ensure drink is garbage. And there's things like it that are also garbage. So what I found that's the best, that's kind of like, doing what the Ensure is supposed to do, but way better, are things like Kate Farms or Liquid Hope. So Liquid Hope is actually suitable for feeding tube. If you have a feeding tube, Liquid Hope is great. Kate Farms is also just something you consume. And what's great about it is it's organic, it's designed to be easily digestible. There's no allergens, no GMOs, no sugar. It's got healthy fats, healthy protein, healthy calories in the ratio that is needed specifically for cachectic cancer patients or cancer patients that are losing weight. So Kate Farms is something I recommend, and they're plant-based as well. And you can also do liquid hope, even just, you don't have to, if you need a feeding tube, that's what you want. If you don't need a feeding tube, you can still take it. And that is another really good, clean, healthy meal replacement. And I'm gonna leave you a link in the description box where you can get all kinds of tips and tricks on how to add more calories and protein to your everyday meals. I just don't necessarily agree with all of these because they're from like cancer websites and whatnot, and even integrative, more natural ones. But there's still some things that I'm like, I don't think that's the best thing to take or to do. But that's beyond the scope of this video. But anyways, there's some good general practices in there. Things like, adding adding oils to your food, adding nut butters, avocado, chopped up nuts and seeds to really bulk it up. There's just some things on there that are iffy, like adding a bunch of dairy, sugar, you know what I'm saying? But there is some good techniques in there for different ways you can bulk up your food with more fats and more protein. So I'll leave the link in the description box. Something I recommend to do is extra virgin coconut oil. Take a few tablespoons. Dose is going to vary depending on your situation, but at least a few tablespoons of extra virgin coconut oil daily. And another thing that's used by naturopaths is also adding coconut flour and coconut milk to things. And like the canned coconut milk, unsweetened, is better than like the stuff you buy in a carton. And bone broths can be very nutritious too and nurturing. And things like, turning the fruits you would make into an easy to drink smoothie, because you can pack a lot in a smoothie. You can put vegetables in your smoothies as well. Okay, let's get into some supplements. So these supplements are going to be great if you're more early on in this for prevention, and even if you're advanced, you still definitely want to do these supplements. They will be of some value. So I'm excited to tell you about EPA. That's right, the omega-3 EPA. I'm not even going to pronounce it, but there it is. There it is spelled. So this is perhaps, quite possibly, the most important supplement you can take for cachexia and the concern of weight loss. EPA, about 2 grams daily. Now, this does a lot of things. Improves appetite, weight gain, quality of life, but kind of one of the biggest things it does is it inhibits TNF alpha. And TNF, without getting into too much biochemistry and science, TNF alpha pathway and what it does is it really is responsible for a large part of this whole process of wasting away in cachexia. So if we can inhibit TNF alpha, we can really make a big difference. So EPA is one of the best things for that, but it does a lot of other things as well. So together, it's very effective. EPA, 2 grams. And some of the integrative cancer professionals I know highly recommend seal oil, harp seal oil. You can find it in highly concentrated, high quality amounts in seal oil, marine oils. And as somebody myself who is vegan, it kind of is disturbing for me to recommend seal oil. But I figure I gotta relay the evidence here. But you can find it in other places. You can find it in a sardine, anchovy oil, krill oil. You can even find it in fish oil, but you have to take more if it's just regular fish. And then, of course, there's concerns with fish oil being rancid and things like that. You always want to go for the highest quality oils. And It can be a bit pricey to do it at this dose because it is a higher dose than the average person is taking, but it's worth it. Again, this is your life we're talking about, so definitely do this. And other things that inhibit TNF alpha that can be useful are EGCG, which is the component found in green tea, and curcumin. And those have wonderful effects with cancer anyway, so they should be part of your regimen for lots of reasons. And then there's melatonin, which also has many anti-cancer benefits and is a beautiful thing to take. But melatonin is also great for preventing and even treating cachexia. So, of course, these things are going to be better if you take them earlier on. But melatonin and the cancer dose is 10 to 20 milligrams daily. And if you have a blood cancer, then it's be a little bit more cautious with this one. It's still good to take it around the times of your conventional treatment, like during chemo, radiation. But anyways, this is why you want your own health professional to talk to about your specific situation. But melatonin is another top one that's really good. And then I guess the rest are not necessarily in any particular order. There's L-glutamine. L-glutamine is popular for healing the gut, but it is very great for way too many reasons I can't get into for cancer. And you may and also be wary of the myth that you should not take L-glutamine in cancer. And yes, cancer can use that nutrient as well, but from all the evidence that I've stacked up and compiled and all the people that I've listened to talks from and things like that, that it is perfectly safe to use L-glutamine in cancer, and it is a great addition to preventing weight loss. And then not to be confused with L-glutamine is L-carnitine. Yes, another type of amino acid. So L-carnitine we think of a lot of times with nerve repair, but L-carnitine is another good one. It actually has been shown in studies to inhibit cachexia in pancreatic cancer. So it's been showing some good effects, and it's also anti-inflammatory. That's a great addition. Oh, another thing that inhibits TNF alpha, remember I said TNF alpha is one of the drivers of cachexia and loss of appetite. Another inhibitor, besides we have so far the EPA, EGCG, curcumin, and another one that inhibits TNF alpha is cat's claw, the herb cat's claw, Uncaria tomentosa, I believe it is. And this is another wonderful addition to take, not only because it inhibits the TNF alpha, but it's also an immunomodulator, which is great in cancer. It's also an antioxidant. It's also antimicrobial. Yeah, it's a great thing to take also. Another thing that has been proven helpful, it was actually discovered by an MD that was working with AIDS patients, working a lot with AIDS patients in Africa as well as Canada, I believe it was, created his own little anti-cachectic concoction. And what he found was the most effective for preventing cachexia. This is AIDS patients, but very similar process basically, was R-alpha lipoic acid, R-alpha lipoic acid, grapeseed extract, and grapeseed extract has been proven to have lots of good anti-cancer benefits, grapeseed extract, vitamin C, and pumpkin seeds and Brazil nuts. So yeah, add those to the diet for sure. Another vitamin that's helpful is vitamin E, particularly vitamin E succinate. And then there's this product. It's like a product from a company called Oral Mat, and a lot of NDs have been using this successfully. It's an activated ryegrass extract, and I believe the dose is like 3 drops sublingual under tongue, 3 drops sublingual 3 times a day. And then there's a couple other things that I would consider potential options as well. And that's homeopathy. You know, again, homeopathy is really specific to the individual, but these are some homeopathics that have proven to work oftentimes, and that's arsenicum iodatum, and phytolacca, especially for emaciation and rapid exhaustion. And then some other supportive nutrients, good things to take could be magnesium, colostrum, and branched chain amino acids. Here's a cool one from Chinese medicine. Another really great supportive general tonic is royal jelly and ginseng. This is a general supportive nutritive tonic for qi and the blood, and it strengthens, invigorates, it does restore appetite, and here's the cool part. It restores body weight and restores absorption in the gut of nutrients and medicines. So it's an awesome thing to take as well. And if the person happens to be more yang deficient, which is pretty likely, then you can add more ginseng, whether it's Panax or Siberian ginseng. And then, this royal jelly ginseng concoction is best taken with reishi mushroom, Ganoderma. Reishi mushroom, which is also, the reishi is also a TNF alpha inhibitor. So those three work really well together. So there you have it. Some general tips and tricks, supplement recommendations, and even a little bit of dietary recommendations, and even some math on managing weight loss and cachexia. Remember, this is a serious condition, so do seek the help of someone who can work with you one-on-one, whether it's a naturopath, an oncology-focused dietitian or nutritionalist, something of that nature. And don't forget to check the links in the description box for the video I have on specifically appetite, how to restore appetite or prevent loss of appetite, as well as some links for more specifics on how you can add more protein, carbs, and calories to your food. Okay, I hope you found that helpful, and there you have it, your monthly naturopathic take on a side effect of conventional treatment, or in this case, a side effect of cancer itself. So much love on your journey, and just keep doing your best, and you can heal yourself.